Atovaquone, a medication that is gaining popularity in the healthcare field, has proven to be extremely effective in treating a variety of conditions. This powerful drug is used for several indications, and its impact on patients has been overwhelmingly positive. In this video, we will discuss the common uses of Atovaquone, proper dosing guidelines, potential side effects, and the opinions of those who have used it. As a versatile medication, Atovaquone is primarily prescribed to combat parasitic infections, such as malaria and toxoplasmosis. It works by interfering with the growth and reproduction of parasites, ultimately eradicating them from the body. The dosing guidelines for Atovaquone vary depending on the specific condition being treated, as well as the patient's age, weight, and overall health. However, healthcare professionals typically prescribe this medication as a tablet or suspension to be taken with food. While Atovaquone can be highly effective, like any medication, it can also cause side effects in some individuals. These side effects may include nausea, vomiting, diarrhea, and headaches. However, it is important to note that the occurrence of these side effects is relatively rare. Overall, the feedback from those who have used Atovaquone has been positive. Users often report significant improvement in their condition, with many experiencing a complete resolution of symptoms. With its wide range of uses and favorable user opinions, Atovaquone is rapidly becoming a go-to medication for the treatment of various parasitic infections. What is Atovaquone used for? Atovaquone, a medication that is gaining popularity in the healthcare field, has proven to be extremely effective in treating a variety of conditions. This powerful drug is used for several indications, and its impact on patients has been overwhelmingly positive. In this video, we will discuss the common uses of Atovaquone, proper dosing guidelines, potential side effects, and the opinions of those who have used it. Common indications for Atovaquone. As a versatile medication, Atovaquone is primarily prescribed to combat parasitic infections, such as malaria and toxoplasmosis. Malaria is a serious disease caused by a parasite transmitted through the bite of infected mosquitoes. It affects millions of people worldwide, particularly in tropical and subtropical regions. Atovaquone has shown great efficacy in the treatment of malaria, both for acute cases and as a prophylactic measure for individuals traveling to high-risk areas. Toxoplasmosis, on the other hand, is a parasitic infection caused by Toxoplasma gondii. It can be acquired through the ingestion of undercooked meat, contaminated water, or contact with infected cat feces. Atovaquone is commonly used to treat toxoplasmosis, especially in immunocompromised individuals, such as those with HIV, AIDS, or undergoing organ transplantation. In addition to malaria and toxoplasmosis, Atovaquone has also shown promise in the treatment of other parasitic infections, including babesiosis and Pneumocystis pneumonia, PCP. Babesiosis is a tick-borne disease caused by the Babesia parasite, while PCP is a lung infection caused by Pneumocystis jirovecii. Atovaquone is often used as part of combination therapy to effectively treat these conditions. Dosing guidelines for Atovaquone. The dosing guidelines for Atovaquone vary depending on the specific condition being treated, as well as the patient's age, weight, and overall health. It is important to follow the prescribed dosage and duration of treatment instructed by a healthcare professional. For the treatment of malaria, the typical adult dosage is 750 mg of Atovaquone, taken orally with food, once daily for 3 days. For children, the dosage is based on weight, with the recommended dose being 20 mg per kilogram per day. It is worth noting that Atovaquone is often used in combination with another antimalarial drug, such as proguanil. In the case of toxoplasmosis, the recommended dosage for adults is 1,500 mg of Atovaquone, taken orally with food, every 12 hours for a duration of 6 weeks. Pediatric dosing should be determined by a healthcare professional based on the child's weight and the severity of the infection. For babesiosis, the standard regimen is 750 mg of Atovaquone, taken orally with food, every 12 hours for 7 to 10 days. PCP treatment typically involves a dosage of 1,500 mg of Atovaquone, taken orally with food, every 12 hours for 21 days. It is crucial to complete the full course of treatment, even if symptoms improve, to ensure the eradication of the infection. Failure to do so may result in the recurrence of the infection or the development of drug resistance. Potential side effects of Atovaquone. While Atovaquone can be highly effective, like any medication, it can also cause side effects in some individuals. It is important to be aware of these potential side effects and consult a healthcare professional if they become severe or persistent. Common side effects of Atovaquone may include nausea, vomiting, diarrhea, and headaches. These side effects are generally mild and transient, resolving on their own without the need for intervention. However, if they persist or worsen, it is advisable to seek medical advice. In rare cases, Atovaquone may cause more serious side effects, such as liver problems or allergic reactions. Signs of liver problems may include yellowing of the skin or eyes, dark urine, abdominal pain, or persistent fatigue. Allergic reactions may manifest as rash, itching, swelling, dizziness, or difficulty breathing. If any of these symptoms occur, immediate medical attention should be sought. It is worth noting that the occurrence of these side effects is relatively rare, and the benefits of Atovaquone in treating parasitic infections generally outweigh the potential risks. User opinions and experiences with Atovaquone. Overall, the feedback from those who have used Atovaquone has been positive. Users often report significant improvement in their condition, with many experiencing a complete resolution of symptoms. The effectiveness of Atovaquone in combating parasitic infections has made it a preferred choice for many healthcare providers and patients alike. Individuals who have used Atovaquone for the treatment of malaria have praised its efficacy in clearing the infection and preventing relapses. Many have also appreciated the convenience of the once-daily dosing regimen, which improves compliance, especially for travelers in areas with limited access to medical facilities. Patients with toxoplasmosis have noted remarkable improvements in their symptoms, such as reduced fever, fatigue, and muscle pain. The ability of Atovaquone to target the parasite directly has been highlighted as a significant advantage in achieving successful treatment outcomes. Feedback from individuals undergoing treatment for babesiosis and PCP has been similarly positive. Atovaquone, when used in combination with other appropriate medications, has proven to be highly effective in eradicating these infections and restoring health. It is important to remember that individual experiences may vary, and it is always advisable to consult with a healthcare professional before starting any treatment regimen. Atovaquone alternatives and considerations. While Atovaquone has shown great efficacy in treating various parasitic infections, there are alternatives available for certain conditions. For example, in the case of malaria, other antimalarial medications, such as chloroquine or mefloquine, may be prescribed based on the specific geographic location and the presence of drug resistance. In individuals with toxoplasmosis who are unable to tolerate Atovaquone or have contraindications, other medications, such as sulfadiazine and pyrimethamine, may be considered as alternative treatment options. It is important to discuss with a healthcare professional the benefits and risks of each medication to determine the most appropriate treatment plan based on individual circumstances. Precautions and contraindications for Atovaquone. While Atovaquone is generally well tolerated, there are certain precautions and contraindications to be aware of. Individuals with known hypersensitivity or allergy to Atovaquone should avoid its use. Additionally, individuals with severe liver or kidney impairment may require dose adjustments or alternative treatment options. Atovaquone should be used with caution in pregnant or breastfeeding women. The potential risks and benefits should be carefully evaluated by a healthcare professional before initiating treatment. Drug interactions are also a consideration when using Atovaquone. Certain medications, such as rifampin, rifabutin, and tetracycline antibiotics, can reduce the effectiveness of Atovaquone. It is important to inform a healthcare professional about all medications, including over-the-counter drugs and herbal supplements, being taken to avoid potential interactions. How to take Atovaquone effectively. To maximize the effectiveness of Atovaquone, it is essential to take the medication as prescribed by a healthcare professional. Atovaquone tablets or suspension should be taken with food to enhance absorption and reduce the likelihood of gastrointestinal side effects. It is important to complete the full course of treatment, even if symptoms improve, to ensure the eradication of the infection. Failure to do so may result in treatment failure or the development of drug resistance. If a dose is missed, it should be taken as soon as remembered, unless it is close to the time for the next scheduled dose. In such cases, the missed dose should be skipped, and the regular dosing schedule should be resumed. Double dosing should be avoided to prevent potential side effects. Conclusion and final thoughts. Atovaquone is a versatile medication that has become a go-to option for the treatment of various parasitic infections. Its efficacy in combating malaria, toxoplasmosis, babesiosis, and PCP has been widely recognized, and user opinions overwhelmingly support its effectiveness. While Atovaquone can cause side effects in some individuals, they are generally mild and transient. Serious side effects are rare but should be promptly reported to a healthcare professional. Before starting or changing any medication, it is important to consult with a healthcare professional to determine the most appropriate treatment plan based on individual circumstances and considerations. With its wide range of uses and favorable user opinions, Atovaquone has emerged as a powerful medication in the fight against parasitic infections. As further research and advancements continue to unfold, Atovaquone's role in improving patient outcomes is expected to grow, offering hope to individuals affected by these challenging conditions.